Hello, everyone, and welcome Pedram Dara to our woodland walk for the month of October. Hello, Pedram.
Hi, Ross. So excited to be here. The
Thank
best
you.
time of the year, and it's World Mental Health Day today.
Is it now?
I know, like we could have not planned a better day for this.
Oh, well, thank you for reminding me or telling me. I will spend a moment to ponder it today. So here we are together, World Mental Health Day, and you are doing some beautiful work in the field of mental health. So I'm going to let you introduce yourself mainly, but I will just say to our listeners that Pedram is really spearheading an amazing forwards motion for the voices of participants in clinical trials to be not just the token kind of, not the token comment that are needed for kind of ticking a box, but actually really shaping how clinical trials are designed, thinking about integration, thinking about all the things that we need more of. And Pedram founded and directed an organization called a Psychedelic Lived Experience. And Pedram has a summit coming up, which I'm very excited to be participating in. But from that, I will pass over to you, Pedram. Tell us a bit about, we'll talk a bit about your work and psychedelic lived experiences in a moment. But first of all, tell us a little bit about your story, how you came to do this work.
Sure. Well, first of all, thanks for having me here. What a pleasure. It's so interesting. I used to like look up to certain people like yourself, and now I feel like we are like we're friends and we're like working together. And so that's very heartwarming, honestly. That's been really something that I think has happened over the last few years, and it's such a dream come true, I would say. So I participated in MDMA therapy for PTSD clinical trials back in late 2018 is when I enrolled in the study, and the study started early in 2019 and finished in mid 2019. And my story is that I came to Canada as a refugee back in 2004 from Iran. And obviously, growing up in Iran, I was already exposed to a lot of traumatic events to begin with. But that journey from Tehran to Vancouver, which took 2.5 months, and with a stop in UK, maybe that was makes it relevant. I was originally was headed to settle in UK, not Canada. Was never a destination. It only changed later on. So I arrived to Canada in 2004 with further trauma added to my backpack, and human smuggling and you name it, like sexual assaults, knife standoff. Those were, I guess, in the PTSD world, they call them index trauma. Those were the two things that really qualified me for this study. The thing is, when I arrived to Canada, like I just thought these things were normal. The trauma that I was exposed to in Iran, I thought was normal. The trauma that, but not normal in a way that actually was helping with my healing. Normal in a way that I didn't pay attention enough to. I needed to do something about it. And I didn't have any, speaking of mental health, I had no mental health education growing up in Iran. Like it's just not a thing. Like only crazy people go to therapists. Like literally people, things have changed. This is 20 years ago, right? Today, honestly, things are very different. But back then, I had no mental health education. So when I arrived, instead of dealing with all that, I just put everything in a box and moved on with my life, right? I just thought like success and money and things like that would make me happy, right? So I went that path for the first like 4 years. I didn't touch any of that. And then I just kept going, moving on with my life. And, I was only 20 back then. So I guess, the extra energy really helped. But honestly, things got a lot worse when I became a father. So around like 2016, I became a father, and I feel like that was, by then I was like starting to be my mid 30s, and like this, like when I lost this sort of sleep, I think you know what I'm talking about. When there was no such thing as a sleep, when the sleep was gone, which is a pillar of mental health, and this some sort of identity shift from like this person that I was to like now I'm a father. Now I have to like care for another human being, and like I haven't figured out how to live on my own. Like how am I supposed to like care for someone else? Like these two things together, I feel like really just made everything come to the surface. So all the things I had like buried for like 15 years in a basement, suddenly the door was open and all the demons were coming out, like after 15 years being in jail, right? That sort of thing. So things got really bad, I would say. Like I became completely suicidal. I had no feelings. I was so numb. Like I couldn't even, yeah, like I feel like my daughter and furniture were the same, honestly. Like I was so numb and dissociated. And so I was either very hyperactive, rage episodes, usually would be like that for like the smallest thing, and then after that would come like dissociation, right? So like once all the energy was out, and then I would just be on the sofa for days at a time, honestly. And it was only one of the days that things got really bad. So it was one fall morning, I probably around this time, and my wife made breakfast, she made coffee. Our daughter was maybe a year and a half, and we were sitting in this fall cold morning, and like I used to get mad at over like the smallest stuff. Like, so she made my coffee, I guess not how I liked it back then. It sounds so stupid now telling this story, but honestly, that's what PTSD is. That's what I'm trying to normalize it by telling the story.
Mm,
That it happens over small stuff. I got so mad at this like small thing that why the coffee wasn't my way. I grabbed a plate of breakfast and I threw it to the wall from like just being so mad. So she grabbed our daughter and left the house. This was like pretty much the closest thing to like domestic violence. Honestly, I'm gonna call it out.
mm,
This was the closest thing I arrived to that point, and which I had my wake up moment. I was like, oh no, this is like I am in trouble. This is not there's something here, right? Like I'm actually now a threat to my loved ones, and obviously I loved them, even though I couldn't feel the love, but like I still had love for them. That was my wake up call moment. Go to distract myself, like most people, to grab my phone, and I'm reading, just like trying to like not think about that. Synchronicity, an article pops up talking about MDMA therapy for PTSD. And at this point, all I know about PTSD is that soldiers go to war, end up with PTSD,
mm,
and MDMA is what you do in clubs. So, being a nerd and geeky, and, it just created a gap of knowledge in my head in that moment. I was like, what? Like, what does these two have anything to do with each other? Like, I just couldn't see the connection between. So, like, that just sparked this curiosity that I need to click on this and read about it. So, the article was talking about PTSD, first of all, and then I had this long list of symptoms of what PTSD is like. And that's the first time I'm looking at this list and I'm like, got that, got that, got that, got that, got that. And I got to the bottom of the list. I was like, okay, I think I know what it is. This is probably what I'm struggling with. And I was like, first time that ever, like, I just thought I was depressed. Like, I just, as much as I know, I'm like, this must be depression, right? It's like, and then turns out that depression was just a symptom of PTSD. Like, it was just something much bigger here. And then obviously went on and talking about immunotherapy. And I was like, wow, I just got so interested. Next thing you know, I'm just reading. So, I'm like the US government clinical trial website, and I'm reading. Oh, they're actually recruiting. It was a phone number for the site that was recruiting, and then I was living in Montreal back then, so I recognized the area. 'Cause I was like, "What? They're actually a site here." So anyway, all of this is happening like just I'm not even thinking. I'm just like reading, clicking.
mm,
I called the number, all in it, like while they're still outside. Call the number, answering machine. Obviously, the psychiatrist picked up the voicemail, and so I just said what happened. I'm like, "This is just what happened at my house. I'm in
mm,
trouble. I'm not feeling well. I need help." I hang up. I got so scared. I was like, oh my God, this police gonna show up now. I can't believe I just told somebody what I just did. Da, 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 da. So he called back two, three times. I didn't answer the phone because I was just scared. I was like, no, oh my God, I'm not gonna answer the phone. He kept calling back from different numbers. Eventually I answered the phone. It was like 9:30 at night. He didn't stop calling, which was amazing. I guess he knew I needed help.
yeah.
Anyways, there's sure that I learned about this study, and then they said like, yeah, we're just one site across all of Canada looking to get one experiential case for our training. So it was two therapists, couples, psychologists and psychiatrists had just finished their MAPS training to go on work on phase three, and they needed to do this one experiential case. So at this point, only 6 other people in Canada had received the treatment in Vancouver, BC. So outside of that province, this had never been done before this in 2018. So essentially, they were like, "We're looking for one person across all of Canada." I was like, "What?" Like they're like, "Yeah, just apply anyway. You never know." I applied. I don't know how many people applied to this point. They never shared that data, but I'm sure it was more than one person. You know what I mean? Like I heard some waiting lists are like around 5,000 people in the US when people were like trying to get into this study. So I don't know what that number was in Canada, but nonetheless, that process took about 2 months, I would say. Started around October, November, and then yeah, by January, early January is when actually, like again, another late night call, and they said like, yeah, you've been selected as the one participant, and the first session is gonna be like in 2 or 3 weeks. I was like, wow. Anyway, study has started early in 2019, I would say, yeah, January, February. I had my first MDMA session was in February, and then second one in March, third one in April, and then I had my 2 months follow up in June. So that's the highlight. I'm more than happy to get into any details of that, but that's sort of how I learned about psychedelics being a tool for therapy and the whole renaissance of psychedelics. Like, this is all like, and then I came out, the Michael Pollan book was just coming out, the Netflix. So I'm sort of like, I was like just at the edge of where like psychedelics were just coming out of the closet in a big way around that time. You know what I'm talking about?
Mm.
And yeah, so like, I just sort of like watched the field take off as I myself also came out, and then the COVID happened, and I had my first relapse after COVID, and that was like, I think the first time that I maybe up to that point, including people like yourself, I'm sure we all used to think like these are just miracles, you do this one treatment, and like, like people were setting out unrealistic expectation, including myself. And I think in a way, COVID stuff helped me. In a way, I'm grateful looking back because like I had like maybe 5 months from when I finished this study, and I felt like I was a brand new person to the world. But like I felt like, oh, my world was upside down inside, and now I fixed that. Sort of, that was the mindset I had back then, and now the world outside is upside down. Like finally, I'm able to like like step to this world, and now the actual world is upside down, right? But in a way, that I had my first relapse, and I think I'm grateful for that because I think it just made me realize that, okay, like first of all, life continues to throw lemons at you, and second of all, that it's what happens after. It's
Yeah.
not, it's not that I just did this and now I'm gone. It's all over. I just real, like the integration, the ongoing support after, all these things I had to learn the hard way just because there was a lack of, it wasn't there, right? So I had to just sort of go through that. Oh, like what do I need? Why don't I have this? Like I want to be in touch
Yeah.
with other participants. I want to like, I couldn't talk about it to anyone, right? So there was still a lot of stigma and like, or people not understanding it. So like I went through all this process of just like, yeah, noticing the gaps and the things that were missing in this field. And should I keep going or you want me to?
Yeah. Yeah. No,
Okay.
absolutely.
Yeah.
Yes, please.
Sure. So then I went on and then I started speaking at conferences, sharing my story a little bit. Back then I was so happy with my own experience that I would just wanted more people to get access to this. Like
Mm.
originally my sort of advocacy work was around like, I guess everybody should do this, like this is like, like why are we not doing this and all that. And then soon enough, by going to these conferences, I realized how much there was an imbalance between the sort of like focus on like clinical and scientific experts, right? So all the people with MDs and PhDs and fancy titles and had all published things, and they would go on stage and talk about things, and none of them ever talked about their own personal experiences. They always talked about other people and their work, and just a bunch of people that were numbers. You never knew, who are these people that actually were talking about. So by going to these conferences, sharing my own story, including ICPR. So in 2020, so I was in Spain. One day, Rick Dublin sent me an email. It's like, oh, I'm gonna be in Amsterdam. There's this conference called ICPR. This is like before COVID, right? Like thing was
Yeah.
still like maybe January of 2020. It's like there's this conference happening in April. Do you want to come to Amsterdam? I'll give you 5 minutes of my keynote. You can share your story. Without
Oh,
obviously checking with Yoast, I'm sure at this. I was like, what? ICPR? What is ICPR? It's a conference in Amsterdam. Anyway, I was like, sure. I was more than happy to do that. But of course, in March, lockdown, COVID, conference got canceled. And then it became a virtual conference, which nonetheless, I still participated. That's how I learned about Yoast and Open. And back then, honestly, kudos to them. They still cared about stuff like this, right? Before
yeah.
I even realized there was a gap,
Yes.
they were already caring about this. And then so yeah, I think I spoke with Michael Mitofer on the panel, and then so that was my introduction to like this whole like more European approach, which was very interesting because I finished the study, I moved to Spain, so I was in Spain. And I, in a way, I got involved in psychedelics professionally in Europe, and I'm very again grateful for that because I feel
Mm.
like Europeans are more grounded, they were less hypey, and especially like people at Open Foundation that had this like more like scientific, more like, yeah, like more sober looking at things. Not, like, yeah, I somehow resonated with that, even though I'm not an academic, but like my background is in computer engineering. I'm a big time nerd. So like it made sense to me that I'm like, okay, like we can't be too hypey about this. These are like technologies. That's how I understood them, honestly. To me, psychedelics were technologies. I'm like, we got to learn how to use these technologies, and we until we know how they really work, doesn't really make sense to like be so hypey about them, right? And like every other new technology at the cutting edge, what happens at the cutting edge? Bleeding. You don't
Mhm.
just say cutting edge without cutting people, right? So so like like I made sense to me. I was like, okay, so
Yeah,
like like we're definitely some people are gonna bleed here. Like harm could happen at the cutting
yeah,
edge, right? Because nothing is really stable.
yeah,
We are rocking on the edge. People can fall from the edge. Whatever analogy you want to use, right?
yeah.
That was the beginning of that. And then I started noticing, obviously, a few of the harmful cases were coming out. And I just pulled back for a while and I was like, okay, what is really happening here? Like, who is driving this? And again, my background was in technology and product management for software. And in that world, you deeply care about, they call them users, right? Whoever is using this product, you deeply care. Like, so as a product manager, I was called the champion of the user.
Mm,
And this is before I even knew there's such a thing called qualitative research. My job was that I would do Zoom calls before, or Skype calls back then. And I had to like watch people how they use the product. I would talk to them. I would be like, okay, like how are you solving this problem? What else have you tried? What didn't work for you? What is working? What is not working? Like you wouldn't make a decision because you were the product person. You would make a decision because this is what the user wants. So like even the CEO of the company had no say over the user. So if I would come back, Roz, and say like, hey, you're the CEO of the billion-dollar company, it doesn't matter. If I would come back and say I spoke to 10 users, 100 users, this is what they're saying, well, guess what? That would be the decision, not the CEO. Unless they had like massive ego or some investment thing they had to do, whatever. If it was really about making the product better, the user was the last person who had to say. I'm like, who am I to say if the button should be orange or purple? If more people are clicking on orange, we're going
yeah.
with orange, right?
Ooh, such a
So I
powerful
came to
phrase.
healthcare and I'm like, what? So the end user has no say, and a
Yeah.
bunch of people who don't use the product themselves determine what the product should be like. Like it just blew my mind away. Then I'm like, so wait, because I just saw this the therapists and researchers the way I would see product managers and developers and programmers and people and UX designers, people that were creating a service and a product that had an end user, right? But then in healthcare, I realized the end user had no voice. It was the UX designer and the developer, and all these people would decide what the product should look like, but not the end user. And then the end user would use it and be confused, or it wouldn't help them, and then they had no way of even providing that feedback. I joke, I'm like, sometimes I go get a coffee and then I get an email back. They ask for my feedback. No one has yet asked for my feedback. Only Maps asked for my feedback in the follow-up study, which happened 2.5 years later. That was the first time. The last question in the follow-up study, 2.5 years is the very last question was one little box. Is there anything else you want us to know about the process that you could let? I'm like now? Like now you want to know? Like you're like a year away from applying to FDA. Now you want to know what my feedback is about the product? Like you're too late. You're not gonna change anything. At this point, it's too late to even collect my feedback. Although I had my feedback and responded it. So this is what I realized in psychedelic care, or at least healthcare in general. I just realized that the end user, which is the patients or trial participants, have no say. And or if their voices are heard, usually it was like in a tokenized way, right? So I was like, oh, okay, so now that we have 100 therapists in this conference, I guess we need one person from the patients. It was like a DEI, like, oh, okay, we have a bunch of white people, we need a brown guy here. It was no different than that. That's what I started noticing, including at Open and ICPR. And this is something I tell Yos in his face too, and he's completely aware of it. There is absolutely a imbalance between that, even though they try, but the imbalance still exists. So, and then that was my aha moment that I was like, why are we not caring about the end users? Like in the end, we are the people who will be mostly impacted by these decisions. Well, then therefore we should have a seat at the table, right? So that then eventually my advocacy became more about that, not so much about we need to give access to people, but more about like the ones impacted the most should be, I'm not saying that they're any more important, but they're definitely not less important. So like they should be at the same table. Like that's all I wanted to see, right? That it's like the decisions are made and someone with lived experience is at the table. And this lived experience doesn't need to be maybe even with psychedelic related, but like maybe just their PTSD, their depression, whatever they've been dealing with. Like somebody who's been navigating the healthcare system for 5 years, figuring out jumping from one psychologist to another psychiatrist to one family doctor, try three different antidepressants, figuring out even what they're struggling. Like that is so much data and is in that and value in that that we're just like fully dismissing. We're not even paying attention to. So like there's really lived experience around like the sort of the health indication that the person is dealing with, but then there's also lived experience around like the solution they attempted. So
Mm.
there's two different layers of lived experience here. And I just realized that the field wasn't really caring about that, right? Because if you don't have a PhD, if you don't have MD, if you're not affiliated with an academic institution, if you didn't publish, like almost your voice doesn't matter because you won't be loud enough. And so luckily, because I was working at Open Foundation back then and Yost was doing qualitative research. And so like, we started talking to him about that. And then so when I took the responsibility of organizing ICPR 22, that's the first thing I told Yost. I was like, well, the one thing I want to do is that I want to make sure the bare minimum, we have at least a panel that like no one with MD and PhD is allowed on the stage. Like, like put them all in the audience and have them listen to people for first time ever, right? Like I don't want to hear from them. Let them just listen in. And then I asked Yost to be the moderator just because I felt like at least he was the best person for that. And that's how I invited Ian and Leonie to come to ICPR. And like it's crazy that back in 22 to that day that I believe was the very first time ever at the major psychedelic conference where there was a panel with only like trial participants speaking about their stories. Like I don't think it had been done before to that point, and that by itself was like, wow, like why are like this should have been the first day, not now. But anyway, that in a way, I feel like that panel, thanks to Ian and Leonie coming, and it became very powerful. Like people crying in the room and all that. It was incredibly powerful experience for people. That set the stage for myself also to see the impact of this work. I was like, okay, like this is really my work. This is what I need to be doing. This is what people need. And so I just kept doing that in different conferences. We just organized one at the MAPS conference last year. First time ever, we did a panel with like all MDMA therapy participants at the MAPS conference. Again, should be a no-brainer. This should have happened 15 years ago. This is a MAPS conference. But to say all of this, I had to push for things. To this day, it's a space that I have to consciously go and claim. It's not a space that I get invited to,
Mm.
which is why I'm building my own table, if it makes sense, right? Because I'm like, if you're not gonna offer a seat, I will build my own table, and then I offer Roz a seat at my table. This is, you know what I mean? Like, I just realized in the end, that's what needs to happen, right? Because even the ones that deeply care about it, I just realized I go look at every nonprofit board. Go look at it. Every pharmaceutical company board, every nonprofit board. You rarely ever see one person with lived experience, even at the board level, even as a volunteer advisor. Like there's rarely a lived experience advisory board ever, anywhere. Like, like you go look at it, it's like all the conferences, MAPS conference, our panel was the only panel. Like, so we had like someone who participated in phase 3 of MAPS trial who got placebo, and then she went to Bessel's workshop at MAPS conference and telling Bessel how she wanted to connect with other participants. Actually, Bessel told her to come to our panel because it was the only panel. Like they had 500 speakers.
Mm.
And our panel, which we had to fight for to get, if it wasn't Rick Dublin pushing for it, we wouldn't even get it, was the only one
Mm.
where you could actually go and interact with people with lived experience. And this happened, what, 3 months ago? So this
Mm.
is today. So even so across the board, there's there's just this imbalance, I feel like, between like so much attention that goes to policy, the legal side, obviously the therapeutic side, the clinical, medical, all of that gets so much attention. And then this side where people with lived experience who actually could really tell us what's going on, what's happening in a way that no published paper can tell you, it's not happening. We are not doing qualitative research. The FDAs of the world are not even requiring qualitative research. And what happens when that happens, then you don't ask questions. And if you don't ask questions, you don't get the answers because you're only asking what you want to ask, and you're not asking open-ended questions. You don't, so, and you're not following people. You don't really know. Like you have this, your endpoints, and it's been like 6 weeks, 8 weeks, and that's it. You have that, and then you move on. You don't really know, right? Like you talk to the same person the very next day of that assessment. I joke to this day, I'm like, depending on which 2 weeks you do a PTSD assessment, I might still have PTSD or not, right? Because that's just how life is, right? So anyway, all to say that I realized the best thing I could do was to bring attention to lived experience,
Yeah.
sort of like pulling back from my background in the tech world, and and see like how could we innovate within healthcare based on those principles that in the end user knows the best. The
Mm.
user cannot build in that world is the same. The user will not be able to code, obviously, right? We need still those professionals, but the user determines the priorities,
Mm. Mm.
right? So in a way, the therapists and the researchers are like the coders and designers, right? But they should not determine priorities. The
Mm.
priorities should come from the end user, right? I give you a practical example. My first MDMA therapy session, like the protocol was that you lie down on this sofa. There was two chairs on each side, right? They're supposed to sit there, and then like maybe halfway through, as I'm feeling obviously the onset of the MDMA, and I'm like, you get a bit heady. So I'm already a bit heady, and I notice myself that I'm just doing this. First of
Mm.
all, I'm starting to like get a little bit dizzy, but also I'm like, it's a bit rude. I'm only looking at one. I'm not looking at the other. I don't, like, so I had to tell them, like, is it okay if you both come and sit on one side just so I could look at you both and not have to move my neck? And then they're like, oh, they told us, I'm their patient one. They told us it's supposed to be this way, but nonetheless, they did it and, all that. But like stuff like this, it's so small, but like it changed my life. I was like, now I can
Yeah.
just look one side and talk to both of you. Just basic like that. There's another great example. The music they tell you is supposed to be non-lyrical. That very same MDMA session, like I've told that story many times before, but I don't think I've shared it with you. But you're not supposed to understand the music. So the psychologist had curated this playlist for me, and the clinical knowledge is that the music shouldn't be lyrical. You're not
Mm.
supposed to understand what it says so that you don't get lost in the lyrics, right? It's more the what the music does to your emotions, right? Except they don't know the difference of Arabic or Farsi or Sanskrit, right? So I have the song on, and as you know, a lot of those Eastern music are now part of. Like you look at any of psychedelic playlist music, it's mainly Eastern music that has crept into
Yeah.
like Western
Yeah.
music, right? So I'm listening to this song, and then I'm slowly paying attention. Beautiful song, I'm like loving it. And at this point, I'm probably my peak. And then I'm like, wait a second, like I think this is Farsi. Like I'm actually understanding. Like at this point, I'm like, I'm probably high. I'm just, I know that there would be no song with lyrics in there, right? What's going on here? So, and then I'm paying attention. I'm like, oh, not only is Farsi, it's actually Rumi poetry, and like it's the most amazing Rumi poetry. It's like it was like the perfect song with the perfect poetry that I needed to listen to at the perfect moment. And it was this like Eastern melodies and obviously poetry mixed with this sort of like organic house or Balearic beats, whatever you want to call it. It was like this perfect infusion of East and West. And at this point, I've been in Canada 20 years. All my traumas were with Iranians, so I had like pushed away all my Iranian culture, but I was also not Canadian, right? And so I had this like cultural identity crisis going into this treatment, and it was this song that it wasn't the therapy, it wasn't the therapist, it was
Mm.
this song that allowed me realize, you know what, it's neither being Eastern nor Western that is cool. If anything, is their infusion that makes it good. Just like how what is making this song. Because don't get me wrong, like if it's all like Ibiza style music, I eventually get bored. And if it's classic Iranian music, I will eventually get bored, right? But this guy had just brought them together and he created this third thing that was better than any of them alone. And I
Mm.
was like, this was my very first psychedelic insight. I was like, wow, like I get goosebumps. I was like, so I could just be like this song. I don't have to be Iranian. I don't have to be Canadian. If anything, I could be a fusion of both. And that's what makes me unique. That's probably actually what makes me even a better human being, right? So I get so excited. I get the things off of my face to share this with a therapist that I just had this massive insight and all that. And then they're like, wait, you're understanding the music? I was like, yeah, there's they freaked out, especially her who was in charge. Oh my, she thought we broke the protocol. Oh my God, like you're not supposed to understand. Like she had this like anxiety and panic moment while I'm having my own like obviously 100% opposite like, effect. And I was like, no, 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 it's totally fun. If anything, this is a miss. She's like, you sure? Okay, la, la, la. I was like, yeah, I made her play that song 5 times in a row. And then I listened to the whole album and then like, but it's these things, right? So it's like one of those great examples of like, who decided the music should be non-lyrical? Tell me, who? Was it the end user or was some therapist decided that? Because if you ask me, if it's the right song at the right moment with the right lyric, man, that's more powerful than your evidence-based CBT. Would have never done that to me. You know what I mean? Like so it's these sort of things that led me to like I was like, okay, like we really need to allow like these experiences almost cannot be standardized. The
Yeah.
protocol cannot be standard. This work is deeply personal. And the more you try to standardize it, the more you try to bring protocols, the more you try to be like, this is how it should be done. From all of it, from dosing, setting, all of it. And then I realized how there's a fundamental flaw here because we're trying to take something that a process like healing that is extremely organic,
Mm.
and we're trying to like put it in this rigid scientific box. Again, I'm very scientific myself. I'm very nerdy. Like I had read the entire MAPS Pro 80-page treatment protocol. To this day, I don't think any other trial participant has read. I honestly don't even think my therapist had read the whole thing. There would be time I would tell them I read something in page 57 or whatever. They're like, "You sure?" Like I'm like, they wouldn't believe that I had read the whole thing. They're like, no, no, trust me, I've read it. I know what you're supposed to do. Like, I knew what they were doing to me. I'm like, oh, that sounds like IFS. I know. Like, I'm that nerdy, right? And still, I'm like, this is such a personal and organic process that we're trying to like put it into this like all these like clinical scales. I just feel like we're like reducing it. It's like a reductionist way of dealing with actually what's really happening here.
Mhm.
And so yeah, since then I realized that the best thing I could do was that, like just bringing more attention to why lived experience matters and why we should have a seat at the table and why people should listen to those with lived experience and why, yeah, why this is probably, if not the most important voice in this field, at least just as important as the therapist voice and the researcher voice and the policymaker voice and everybody else, right? Like this is it's a dinner table. We all should have a seat, right? Decisions shouldn't be made without the end user presence.
Mm.
And yeah, so then I was like, okay, then let me first organize an event, like an online conference where like originally I wanted to only have patients and trial participants. Like I was like, we've seen enough of therapists and researchers talk about this. Let's just have a conference where it's only patients and trial participants. That was the original idea. And the reason actually I decided to do this was I spoke at the FDA AdCom meeting when they were deciding on approval of MDMA. That was the day I decided to do this work. I spoke at that event for 3 minutes, which you'll be surprised how much you can say in 3 minutes, honestly. But I watched that event 9 hours live, and I saw how on one hand we had all these lycos and pharmaceutical people, which I couldn't resonate with, honestly. On the other hand, we had these FDA AdCom people, none of them I could resonate with. There was one person who was supposed to be like patient advocate at the table. I don't even think she was a PTSD patient,
Mm.
let alone having tried MDMA therapy. And then I was like, what? And then they allowed in that same AdCom meeting, bunch of critics, let's just call them, including from other countries, as far as Australia. They were allowed to speak for 3 minutes, the same way I was allowed to speak for 3 minutes. If anything, some of them spoke before me. And I was like, okay, not only people like me are not in the room, now that you have this public opinion meeting or whatever, you're just treating someone like me and some random critic in Australia the same way. Like what? Like so we all get the same time and we all have the same like look, who are you actually listening to here? Like, why are you not running these questions? Let's say the question was like, oh, MDMA might allow people to have this euphoria thing, and MAPS didn't. track the euphoria thing. And like, so like, what if people want to go take MDMA later? Oh, okay. Let's just say that's a valid concern. Okay, cool. We'll ask the people. It was 300 something people who went through it, right? Hey, what, like, did you think of doing MDMA 4 weeks after? Like,
Yeah.
like that is the only answer that matters, not the psychiatrist's opinion,
Mm-hmm.
right?
Yeah.
Like, if you didn't ask, then you didn't always get the answer. And now you're sitting there and you think just because you're a psychiatrist, then you think that you know what euphoria might do for MDMA, and you probably never done MDMA in your life. You probably don't have even PTSD to begin with. It's just like, why is your opinion more important?
Mm.
And did you ask and then you got some, like, you didn't even ask. That's the thing. It's not like you ask and you didn't buy it, but like you didn't even bother to ask, right? So there was this sort of things like asking these questions. There, all their concerns was never run by, like, what I wanted to see was like, yes, let's have the pharma people, let's have the outcome, but let's also put the participant there. Run the question through everybody. Like, have someone who had great experience, have someone who had terrible experience, have someone who had so-so experience. Run all, like, have three groups and then run all the questions through all three groups and then see what comes out of it. Like, it's just not that hard. So watching that meeting that day and walking out, obviously I knew this was not going to get approved that day. It was very clear. And to be 100% honest, and I came to ICPR the very next day. I think you were there too, and I met Rick Dublin like literally the next day, and he said, what did you think it was that? I said, I actually didn't want full on approval that day. Like, I'll be honest with you, all I want was like some sort of a slow rollout. That's what I want. I didn't want this. I knew we were not ready for some sort of like I'm like, clearly we're not ready for like mass adoption, but some sort of a slow rollout, some sort of like real world setting. Let's see what happens. Like maybe allow 500 people to get it in a real world settings, and then assess that, and then see, does this match what happened in the clinical trials? As you know, clinical trials is not real life, right? Do it in real life, see what happened. Does this match what they saw in research? Then you go from there. It didn't, sure, go back to the boardroom again and the phase three again, no problem. Right? That's what I wanted to see. I don't even know
Mm.
if there was a pathway for that, but I definitely didn't want to full on approval. New York Times headline: MDMA is now legal. That was not what I personally wanted to see that day, because I knew they were not ready. I
Mm.
knew there would be harm if we rolled this out, too soon, too fast.
Mm.
So it was that day that I walked out. So I came, I came to ICPR the next day, and then I saw Rick that day, and I said, you know what? Like, I realized this is it. Like, I need to build bridges. And then I remember he said Timothy Leary told him early in life that if you want to build bridges, you have to be willing to get stepped on. And I was like, oh, okay. I didn't get it back then, and I've just recently was stepped on a few times in the last few weeks doing this work. And then I was like, okay, I know what he was talking about now. So yeah, I decided that originally I wanted to be only the patient participant, but then I actually realized I need to build bridges
Mm.
between therapists, researchers, and the patients, right? I felt like they were working in silos, and actually my work wasn't, although I felt like my work was bringing attention to the lived experience, I realized actually the real work was building bridges between clinical science and lived experience. Like, as long as these people are talking to each other, I felt like that, like, the information can go back and forth on this bridge. I felt like that was what I needed to do. So that's when I decided to then invite people like yourself to the summit, because I'm like, you know what? I actually need them as allies, right? Like, I need them to also put their hand up and say, yes, lived experience matters. And yes, we don't have all the information. And yes, we need a full picture. And what allows us to see the full picture is if the lived experience voice is there. Without it, you're not seeing the full picture. It's like driving in the fog, right? So that's when I realized that, okay, then I needs to have both of them need to be at the table. But the experts, the clinical scientific experts that I decided to bring in, I wasn't talking to them about the same stuff that they usually talk about, right? It was more like, as you did with our interviews, it was more like, okay, what are the barriers? Why are we not doing this? So like, essentially, these experts are talking about a topic usually they don't talk about. So new information was coming out, which was also very helpful and learning for me. Also was allowing me to see where pockets of this work is actually happening. For example, Imperial, I found out Sarah Reed, who is there, she said they're actually allowing for first time ever someone with lived experience in the trial to be a co-sitter.
Mm. Fantastic.
You know what I mean? So this sort of thing. And then I found out in Australia, they did like a psilocybin for general anxiety disorder. And then they had people from the initial trial to then work as lived experience advisor in the future trial. So like these sort of things that I saw, I was like, oh, pockets of this work that was happening that I didn't even know, that I would have not known if I wouldn't interview these people. But then I also realized that then others can also learn from them. They're like, oh, well, if Imperial is doing that, if Monash is doing that, maybe we could also do that, right? So I felt like this could actually inspire others to also do more of this work. And then, so yeah, the summit is coming up in November 21st. It's a 3 day, 54 speakers. I have 27 people with lived experience. They're not all from clinical trials. A lot of them are from like in Switzerland or in Canada when we have compassionate access program, or they're from like, people who've gone to like ketamine clinics, Spravato, including like esketamine. So it's not only trial participants. So it's just anyone who's done any sort of clinical, legal, above the ground treatment with psychedelics anywhere in the world. And
Mm.
then we have 27, mostly I would say therapists, but yeah, some of them are like physicians and researchers. And then we have like live panels during the 3 days, but then people will be able to like watch all the 54 interviews during those 3 days. It's kind of like an online conference, kind of choose your own adventure. Better than I would just say, even in a conference, you have to be somewhere at a certain time. This, with the exception of the panels, people can watch it anytime during that 3 days, anything they want. And yeah, so my hope is that post summit, the big vision that I have here is that I want to see lived experience be recognized as an essential expertise in this field in a way that hopefully maybe we can formalize some sort of a training and a certification program. So that's really, I would say,
Mm.
my multi-generational dream is that one day in future, anytime somebody's receiving any sort of diagnosis for a health indication, the same day that you're assigned a doctor, that same day you're assigned someone with a lived experience in whatever thing is that you're going through.
Yes. Oh, I
You know
love
what I mean?
it.
Like, doesn't matter if you got cancer or you got PTSD or whatever it is, but that very first day that you're assigned a doctor, you're assigned someone else who's been there, who's going to be part of your journey,
That's
right?
such a
Like,
beautiful idea.
right? That is the world I want to live in. That's the world I want my daughter to live in. Like, because it's these journeys are very isolating. I'm sure you know what I'm talking about. We all have had some health indication where you felt isolated, you felt like no one gets you, and then you go read online comments of strangers, and you somehow feel more seen and understood by them than your doctor.
Yeah. I mean, I was just thinking about that and thinking about a personal example about how amazing it would have been for me. So I had a diagnosis at the doctor of having a genetic condition. So they told me that I was going to have a double mastectomy and my ovaries removed in a very kind of like clinical matter of fact way, but I wasn't connected with anybody else that had the same thing or anything else. And what I was offered instead was a group that was run by psychologists, where the psychologists kind of talked to us about what we should know, what they thought we should know. And there was no chance for us to talk to each other. So after this circle, which was actually really unhelpful because they exposed us to lots of information that we some of us weren't quite ready to hear yet. It was not, it was very scientific and kind of fact-based rather than where like thinking about our perspective. And so the most helpful part of it was after the workshop, we kind of met each other quickly in the hallway and said, oh, had a little chat. But that was, if I had been given, as you're saying at the time, the number of somebody else who was willing, who was further along the journey and was willing to talk with me about what it would really been like, what I could do now, what I might need to buy before my operation, that would have changed everything. And it would have saved, I mean, it would have just saved so much extra stress. So if you think about for the healthcare services like nation, like globally, how much resource would be saved simply by putting people in touch with somebody else and how meaningful it would be for the person that has been through that a few years ahead to be able to help someone else that's just got that bit of news or is just struggling with that thing. Like I imagine for you now working with somebody who is going through some trauma to do with being a refugee, having PTSD, the support you could give that person would be so meaningful for you too. I mean, you're doing all of your own
Oh,
services a different
absolutely.
way, but I love your idea. I think it could change, world changing actually.
Yeah, yeah, yeah. I applied a TED talk with this. I didn't get approved though.
Oh no, okay, keep
You know
applying.
what I mean? I was like, well, I guess there are better ideas out there. But anyway, it does, I also don't have MD and PhD. I'm sure even Ted cares about that. But like, this is the world we live in, right? Like, you gotta understand the same idea. I'm sure if someone at Stanford would have sent that idea to TED. Same thing, but like a psychiatrist at Stanford, he'll be speaking on TED. This is
You
the world we live in, though.
don't give up though, Pedram.
No, I'm not giving up.
You're
Again,
gonna
I'm
get
building
there,
my own TED.
but
Yeah,
even yeah, with the, I want to see the TEDx.
that's what I do. I'm like, you don't offer me, I'll build it myself.
Well, maybe this summit work, cool, what we were talking about earlier, maybe we can just quickly cover this as well, is
Yeah.
we're talking earlier about how I was asking you how it was going with the summit and how kind of, if you had lots of interest, if lots of people had booked tickets. And you told me that you've had this absolute influx of interest from loads of people wanting to talk to you about it, that the awareness is being raised of this work you're doing. Lots of people have signed up for the summit. So it sounds like there's this sudden momentum around understanding the importance. And I was going to ask you about why you think that is. And actually, I had a question. Maybe we can tie the two together. I think it's quite a deep question, really, which is you talked really movingly before about all the reasons why there is this kind of defense. There is the kind of like the healthcare professionals,
Mm.
and they're doing their thing, they're planning it all, they're doing it their way, and there's this kind of like wall up. There is this kind of pushing away. And how it obviously doesn't make any sense. And in the tech world, it made complete sense for you to be asking for people that were going through the experience what it was like and what they needed. So I suppose I have two questions for you. The first is, why do you think, as human beings, as a culture, we have for so long had that pushing away in mental health care, particularly not in the world of tech, but in mental health care, this pushing away of lived experience? Number one question. And number two question is, and why is that shifting now? Like, what's changing now?
Yeah, those are a fantastic question. I think the first is, the now have a lot of doctor friends and scientist friends that I didn't have, which is incredible. So when I talk to them, I realize the pattern is that they just think lived experience is some sort of anecdote. It's like, oh, that's just you. Like if I can't see 100 people, if I can't quantify it, almost it doesn't have value. Like they're just so like into that scientific model as if like if I can't see it, then it's not there. Almost like if I can't see God, then definitely I'm atheist. And don't get me wrong, I used to feel that way about myself. Now I'm a bit more agnostic. Now I'm like, just because I don't see it doesn't mean it's not there. Like I'm a little bit like even my own worldviews has changed. Like, before, like I'm seeing a patterns of that with people that are a bit more science heavy themselves. It's like if I can't really see it in a quantified way, then it doesn't exist, right? And I feel like if you're looking at through that lens, well, then you will never see it. And and it's a challenge for people like me to find a way to quantify this. And I'm working on that and be like, how can we do that? Because in the end, obviously that's how the world works. But I think that has to do with it. And then also a lot of these people like yourself, you spend 10 years and 15 years of studying, going to university, paying lots of money, have debts and all that. Like it's not easy to become a psychologist and psychiatrist. I understand that, right? So like there's a sense of that these people feel like almost like, what do you know? And I've
Mm.
had literally people tell me, what do you know about healthcare? Doctors, not naming names, have told me I know nothing about clinical world. People that go on stage in this field, right? Like have actually told me in person. So this is the world we live in, right? Oh, I don't have a clinical license. So what do I know about healthcare? I'm like, I'm the end user. Like I know everything about healthcare. You know what I mean? Like if anything, your salary is my tax dollars, right? Like you wouldn't have a job without me. So, but this is the world, right? So that's one thing that I feel like the thing. But why now? On the why now, there's more coming. I think there's something about psychedelics by themselves because they're just deeply subjective experiences that or anything CNS related. It's like I feel like it's very different than other areas of healthcare, right? That maybe because we have all these very different subjective experiences, the sort of the human story matters a lot more in this field
Mm.
than it does in other areas of healthcare.
Yeah.
And a lot of the people also that have come to this work, the professionals, they have their own lived experience. Obviously, is what they led them here, but they don't talk about it. But that doesn't mean they don't see the value. So they're resonating with it because they see the value in themselves, even though they don't necessarily talk about it. So like they're like once they see it, once I share it with them, then they can connect their own lived experience to what I'm trying to say. And yeah, so I think that's partly the why now part, that it's like we're sort of this past hype, right? So we went through this hype cycle, and obviously, like any other cycle, was busted, and now we're on the other end of it. So I think the timing is right. Like if I'm whatever I'm doing now, if I would have done it 3 years ago, I don't think would have gotten the attention. I actually think the timing was now. I actually think we needed the MDMA approval not go through for
Yeah.
this to matter,
Yes.
because that's exactly why that happened. Like that's exactly why all the issues with map stuff that happened could have been avoided, going all the way back to the even the sexual abuse case that happened in maps trials. If that participant day one had someone with lived experience assigned to them, well, guess what, that person could share with them, I'm seeing things, is this normal, the therapist told me XYZ, like da 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 da, like they would be able to catch things earlier, even if there are bad therapists out there, which they do exist, right? Like any other field. Well, if you have this other person with lived experience as part of the care team, then the patient participant has someone else to go to when they notice things, when they doubt themselves, when they're not sure. They're like, is this normal? This person told me to do this or da da da, right? And then you can catch things early. So I actually think it's harm reduction. It can actually reduce harm. So if you ask me, if MAPS would have done what I'm talking about, MDMA would have been, not only would have been approved today, we would have not even had that case, because it would
Mm,
have avoided it. And then when it comes to the approval process, you had listened to these people, and then you had the actual data, you had this counter narrative, which they didn't have. So they obviously the one negative case is enough to change everybody's opinion, right? But because they also didn't have this other qualitative side, I asked Rick, I'm like, why didn't you have this qualitative? Oh, FDA didn't require it. And I was like, well, yeah, it's just because they didn't require it, and now you had no counter narrative.
yeah.
Right? So if you ask me, that could have saved Lycos and Maps and millions of dollars, honestly,
Yeah.
doing this work, right? So this is why. So why now? I think
Mm.
this is partly why. And even people that are Dublin agrees with it.
Yes, wow. Really, yeah. And I think this vision around yeah, being assigned somebody else with lived experience of what you're going through is such a power. I mean, for psychedelic work, and obviously can change psychedelic work so much. And I hope we can listen to the lessons in time. I hope we have time to really listen to the end user and really and make space for the complexity that brings, because one of the things I was thinking as well about, like, what is that defense against listening to the perspectives of people going through it, is I think one of them, perhaps as well as like the scientific bias, is expense and complexity. If you listen to someone and say, hey, what do you actually need? And the person says, I need more prep time, I need more integration time, I would like you to sign me some, like, there's more that you need. And some of this I think we're going to have to do in the community, because we're not going to be able to do in clinics. So I think a lot of this we need to, like, really resource our community ecosystems to provide this, with accountability structures, with peer support, with all of that. But I think that listening to people's needs, it brings in complexity. So we have to, the psychedelic community, we have to make space for that complexity and find ways to run it in the community safely. But beyond that, I think, beyond what it can do for the psychedelic fields, I think that this idea of yours is truly, I mean, I'd never even thought that before. It's a really powerful but amazing idea. And World Mental Health Day. So, like, I
I
am just,
know, right?
thank you for for the beautiful, beautiful perspective and ideas. And yeah, the TED Talk's going to happen. It's going to happen. We are
When it's time,
planting
when
the
it's time. Yeah, yeah, yeah.
seed. But no, I think, well, first of all, we have the summit, which definitely is happening in November. And people, how can people get tickets? Just give people a
Yeah,
little.
so basically psychedeliclivedexperiences.com/summit, and then they can sign up for free for the 3 days. They can watch all the recordings for 3 days. That's free. I definitely wanted to have something that money is not a barrier for accessing information. But those that want to have access to the recording, join the live panels, join the community space that we're building, and a bunch of other workshops and trainings, things that we're working on, then they can buy an all access pass, which is also very affordable. And then they have all the time to watch it whenever they want, and they can also join the live panels and interact with the experts. So
Wow, I can't wait. I'm really looking forward to it. And thank you, Pedram. Thank you so
yeah, thank you for being part of it. Yeah, so amazing to have Roz and Acer and both of your support here as an organization and individual.
well. And of course, we get to
Great.
benefit not just from your amazing perspective from work, but from your lovely wife, Honor, who's one of our facilitator team in ASA. So yeah, thank you both for everything you
Wow.
do. all the time.
I know, yeah, it's so nice too. It's like a tiny, small little family with big impact.
Oh, yeah. Oh my goodness. Yes. Yes. You for sure. For sure.
Yeah.
Well, thank you. And yeah, I hope everyone gets their tickets for the summit and we'll see.
Yes, please support it. It's grassroots. You know, we have no sponsors, no corporate agenda. This is the most grassroots thing I've ever done. So those of us watching this, please support it as much as you can. Like, you know, I'm providing peer support for free. I'm actually running peer support circles for people who've done MDMA therapy now for the past few months, and I'm not charging for that. So, you know, so I'm
Mhm.
hoping that if people support what I do, then I can continue to do other things.
Yes. Is there a way people can contribute? Do you have like a Patreon or anything like that? Can people?
No, not yet. I think after the summit, yeah, I'll get a bit more fancy with things like that. Right now, I just want to do the summit, but yeah, I'm trying to see. Perhaps we'll establish a nonprofit that will be able to, you know, continue to do this work, and maybe people could donate too. But yeah, I'm sort of like wanted this process to be a bit to see actually what should be done. Who are the people? Like, you know, even a nonprofit needs a board. Like, who do I want on that board, right? So it's been a really nice way of seeing like who wants to help me, right? And then with that, I can then decide what the best next step is. But for now, would be signing up and buying all access pass is the best way people could support.
So buying the all access pass and supporting this amazing work. And yeah,
Thank
thank
you,
you.
Ross.
Okay, we'll see everybody soon.
Yay! Of course, yeah. Thank you so much for the time, and have a great rest of your day, and happy World Mental Health again.
Yeah, you too.
What a perfect day. Thank you, Rose.